All right. You're welcome back to Morning Crossfire 99.3 Nigeria Info. And the discussion on Morning Crossfire this fine Thursday morning is one that is of importance to every single one of us. It's the World Immunization Week. This happens every year. Every year, the last week of April, we talk about immunization. And more importantly, this is very important because of what has been happening around the world in the last more than a year, the COVID-19 pandemic. I mean, who would have thought about it? Now we're looking at vaccinations across the entire world for the COVID-19. But before then, we've had to deal with other diseases, and there have been vaccinations and immunizations happening for all of those diseases we'll talk about shortly and find out what the trend is like. Remember, you can always join the conversation on Twitter at NigeriaInfoFM, hashtag NigeriaInfo MCF. Questions, comments on WhatsApp 0809-597-5805. At some point, we open the phone lines, and then you can talk with us. Dr. Ijeoma Agbo is a specialist with the United Nations Children's Fund. It's a pleasure to have you join us on the Morning Crossfire today.
Thank you. Good morning.
Thank you very much. And we talk World Immunization Week today, and I know that there are several people who are listening in who want to know what exactly this is about. So first and foremost, why is it important, or what is the importance of marking an Immunization Week with UNICEF?
Thanks so much for that question. So the World Immunization Week is celebrated every year in the last week of April. And this is a week where we aim to promote the use of vaccines to protect people of all ages against diseases. As we all know, immunization saves millions of lives every year. It is the singular most cost-effective public health intervention for protecting against diseases. And globally, we still find that nearly 20 million children are not getting the vaccines that they need, and especially in Nigeria. And the theme this year is Vaccines Bring Us Closer. And this World Immunization Week is a time for us to urge greater engagement around immunization globally and at a country level. We're aiming to promote the importance of vaccination to improve health and well-being. And we're hoping that this is a time when we can also build public trust in the value of all vaccines and build long-term support for immunization.
Long-term support for immunization. And I'm sure you've listened also with keen interest that the conversations that have been happening on vaccine or not to vaccine. In fact, there's a promo that plays here where you have people say, for example, they're depending on the blood of Jesus to protect them to protect them from the ailments and all of that. But that's the wide spectrum of the vaccination discussion we have in this country now and again. And I'm sure you probably are always amused by sort of responses you get on the street when you speak with the everyday man and woman in Lagos or Port Harcourt or Kano or Calabar. Everywhere you get but why is it important that we have vaccinations, Dr. Agbo?
Okay, just as I mentioned earlier, I mentioned that vaccines are the singular most cost-effective public health measure for preventing diseases.
Right.
And as we know, vaccine-preventable diseases account for 20% of morbidities and deaths in our children. And I'm talking about under fives. And it's important that we have them vaccinated. They are the vulnerable group. We also have other vulnerable persons. But if we vaccinate our children on time, we definitely are putting them in the right track to preventing diseases and growing up optimally.
Right.
Also, a year ago, we've been into the COVID-19 pandemic.
Right.
And it had so much effects from the pandemic. Everyone was in the lockdowns. Children were not in school. There was a great impact in terms of access to immunization and other essential services. And so we find out that right now, with COVID-19 vaccines, as we continue to roll them out, this is the best time for us to bring up, trust in vaccination so that we can get on track to some form of normalcy within the country. I also like to reiterate that as a country, we're far from where we're supposed to be. We're supposed to be at a target of 95%, but as at 2020, only 65% of our children were fully immunized. And this puts children at risk of infections. Of course, we can cause paralysis and even death. And for us at Unicef, this is totally unacceptable. No child should die from vaccine-preventable diseases. And so we're using this medium to lend our voice to, improving access, uptake to vaccination, and moving us on track to ensure that every Nigerian is vaccinated.
In case you just joined in, you can watch this also live on Facebook as well as on YouTube at Nigeria Info FM. We're speaking with Dr. Ijeoma Agbo, who is a UNICEF Nigeria health specialist. And on this World Immunization Week, we're drawing awareness on the importance of vaccination and immunization, especially for our children who are under the age of 5. If you're watching the statistics very well, you'll see that this vulnerable group have been most affected in the last number of years. And we're unpicking many of the factors that has made Nigeria remain at 67%, not over 90% where we hope to be. Well, what would you say if you were asked, Dr. Agbo, the factors you think responsible for us not being able to hit 90% today?
So, just as you mentioned earlier, one of the major factors that we're having right now is misinformation. The technical term is vaccine hesitancy, but for everyone's understanding, there's a lot of misinformation that is causing people not to get the vaccines. I'm sure we've heard that vaccines will cause us not to get pregnant. We've heard 666, there are other religious reasons why persons are not getting vaccinated. And this is actually, hampering on our vaccination uptake within the country. So that is one of the major problems that we have presently. Also, we have persons who live in hard-to-reach areas that vaccines do not reach easily. However, we at UNICEF, along with partners, are working with governments to ensure that every child, no matter where you live, gets these important vaccines in the potent form, and everyone has the chance to get vaccinated. So this is one great stride that we at UNICEF are working towards.
You know something also too, Dr. Agbo, I know people many times, we have situations where there's often the dichotomy, the rich versus the poor, and in the same way, the access towards services, access towards, things generally is oftentimes distinguished by those who have and those who don't have. So the vaccination, you mentioned hard-to-get areas. I've seen some of the data which shows that the people who live in the urban areas are more likely to get vaccinated than those in the rural areas where we're having a lot of problems with the vaccination. In a place like Lagos, for example, which is a cosmopolitan city, do you have those sort of challenges in terms of vaccination, areas that are hard to get because of socioeconomic or geographical factors?
So at UNICEF, we always preach equity, and we try to ensure that every person has an equal chance of getting vaccinated.
Right.
Within Lagos, that is largely cosmopolitan, we still have hard-to-reach areas, riverine areas, which we also try to reach with vaccination. The government has done a lot in ensuring that everyone, no matter where you are, get these important vaccines. There are structures in place to ensure that vaccines are delivered, in the right potency to these hard-to-reach areas. We also have outreach programs which are being supported by UNICEF and other partners to ensure that even if the health facilities within those areas are not working optimally to provide these vaccinations and other important essential health services, because this is not just in terms of vaccines, that we have outreach programs in these areas to ensure that every child and every woman and every other person has access to immunizations and other services as well. If
you've got any questions for Dr. Agbo, the number on WhatsApp is 0809-597-5805. Again, 0809-597-5805. On Twitter at Nigeria Info FM. At some point, I open the phone line so you can also join in. I will get to the WhatsApp messages and questions and Jiffy. So, Dr. Agbo, I was going to ask a question, lest I forget. You talked about the COVID-19 and the implications for a number of people. The lockdown, I've spoken with a number of health professionals. Many of the people said that the lockdown affected them in a way, when you speak with them, they say at some point people couldn't get access to regular health services because of government directive and focusing mainly on the COVID-19. This was during the peak. And then after that was eased. But then I did hear something troubling, that a number of people did miss their vaccination schedule, which usually is maybe on a quarterly basis or half a year basis. But we had some reports of irregular immunization or vaccinations happening. Can you tell us some more about this?
So during the lockdowns, even though a lot of persons missed vaccinations, the health facilities actually didn't close down. Persons could still get vaccinated at these health facilities. But of course, with problems of transportation to the health facilities, as well as fear of the COVID-19 as well, caregivers did not visit the health facilities. However, we've been working with the Lagos state government, and I know this is also with other state governments across the country, to send reminders to caregivers and continue to hamper on the fact that even if you've missed your vaccines, you can come to the health facilities to get on track for your children. This is something that we continue to reiterate because missing these doses puts us at great risk of vaccine-present disease, and also we're a global village. And so once you have a disease outbreak, it can easily spread, across the states and across the country. And so, yes, there was a lockdown. Health facilities continue to work, but due to fear as well as difficulty in getting to the health facilities, children missed their vaccinations. But we've been working closely with the government to ensure that persons caregivers bring their children to the facilities to get on track with their vaccination schedules.
Just to remind the listener, the vaccines that are important, mandatory for children under 5, that they should have. Help us run through them again. For them who understand 18 months and below.
Yes. So you want to know the vaccines?
Exactly.
Okay. So we have HPV, which is for hepatitis B.
Good.
As well as OPV, which is for polio. This is given at birth.
Right.
As well as BCG, which is against tuberculosis.
Right.
Then at 6, 10, 14 weeks, we get what we call the penta, which includes diphtheria, pertussis, tetanus, Hep B, as well as HPV. This is given at 6, 10, and 14 weeks. Also, we get IPV, which is also against polio. At 9 months, we get measles and yellow fever. And measles second dose is given at 15 months. So I've run through.
Excellent. Thank you very much. And
schedule.
All right. Sorry. Say that again, please. We missed the last part of what you said.
These are presently provided on the Nigerian schedule.
Excellent. Provided on the Nigerian schedule. And help us understand how important it was for the vaccination against polio on the Nigerian schedule was important in kicking polio out, for example, from the country.
It was very important, and a lot of work went into that. I'll actually commend the government as well as partners and other stakeholders who brought Nigeria to a point where we could be satisfied polio-free. However, the work hasn't ended. We need to stay polio-free.
Right.
And so we need to ensure that we continue to vaccinate our children to ensure that polio stays out of Nigeria. Continue to ensure that your children get their polio doses at 0, 6, 10, and 14 weeks. And with that, we'll stay polio-free.
Stay polio-free. Another one I'm hoping that we can stay very free quickly as possible, better sooner rather than later, is the one that we had mark the day earlier on this month, malaria. Interestingly, I did hear there's a malaria vaccine trial going on, and it was tried in Burkina Faso. They got about 75% success rate. There's still some distance to go, but we are novices in this sort of thing. You think a malaria vaccine will happen sooner rather than later, or there's still some long way to go before we have a vaccine against malaria?
Well, we've come a long way. There's a lot of advancements in vaccines. We can see how quickly we came with the COVID-19 vaccine,
Mm,
and so they're also looking at using, those advancements in bringing about a vaccine for malaria.
mm,
So
mm,
with that result, they're actually moving to a third trial, a
mm,
third phase trial,
mm,
and we're hoping that that trial will definitely get the malaria vaccine very soon. We can't put a time frame to that,
mm.
but we're hoping that we'll have excellent results, and so that we can have malaria as a disease that we can look at eradicating soon.
Eradicating. That's one word I love. We will all want to hear eradicating because so many children under 5 have to go through this nightmare, and it's such a tragedy that all these years. But thank you very much. Malaria vaccine. We hope we can tick that out as quickly as possible. You mentioned COVID-19, and that's a huge step. A huge step that's been taken in the health science world in how the vaccine has emerged. You want to say something about that before we go on a quick break?
So Nigeria rolled out the COVID-19, the AstraZeneca vaccine earlier on in the year. And though, yes, we only got about 3.9 million doses approximately within the country, but we've done very well. We vaccinated over 1 million people in Nigeria. But as the vaccines keep coming in, we definitely believe that as more supply comes in, we urge Nigerians to get vaccinated with the COVID-19 vaccine. COVID-19 had a very negative impact on the country and the world at large, and we need to get back to normalcy, or even better than normalcy. And we can get this with the COVID-19 vaccine. There's been so much misinformation, especially on the social media. And this is one time that we know that everyone has a responsibility to ensure that the vaccines are rolled out and that public trust is improving the vaccine. You, as the media, we need you to continue to drive the message out,
Right.
and positive messages as well.
Right.
The misinformation has drastically brought down the uptake of the vaccines, as we can see in the first phase. But we believe that in subsequent phases, we'll have a better uptake, and we need everyone and all hands on deck for this.
Absolutely. We need all hands on deck, and indeed, we're partners with the United Nations in this. I like what a resident doctor friend of mine told me, that the vaccine is like when you're in a vehicle and it's like seat belt. You put the seat belt in. If you have the seat belt on, when the crash happens, you survive, which is what the vaccines do for us. Not just with COVID, but with every other thing. But we're going to go on a quick break. Dr. Agbo, UNICEF Nigeria Health Specialist. We'll be right back. Please stay with us.
Are you struggling financially? Do you want to make extra income and retire in wealth? Then join Cash FX Group. Guaranteed daily income with zero loss. Weekly profit withdrawal. In over 180 countries. No sales or monthly subscription. Start earning after 3 business days. To participate, WhatsApp POWER to 0703 728 4162. Send POWER to 0703 728 4162. Our mega event is coming up 1st May 2021 at Mega One Event Place off Orchid Hotel Road, Chevron Tollgate, Lekki by 10 a.m. Admission is free.
Before now, getting a good HMO that works perfectly for my staff was a lot of hassle. Many HMOs come with cumbersome registration. It gets worse when my staff come back to complain about the terrible service they get from these HMOs. I decided to give Reliance HMO a try based on glowing recommendations I received from my HR colleagues, and I was not disappointed. I was able to register all 100 staff in 5 minutes. I have access to a 24-hour responsive helpline and an account manager that helps me with any issue. My staff raved about the premium service they receive from Reliance HMO. They especially love the access to gym, spa, dental care, and the hospital roaming. I no longer worry myself about issues concerning HMO. Reliance HMO does that for me. I will recommend them any day.
Visit reliancehmo.com/corporate or call 0700-7354-2623 to get a quote for your company and start enjoying reliable sabi who they call no pick am.
No matter your phone, whether you get data or not, you say fit sabi who they call. Turn up Kulele Mind with MTN who they call. Now 5 naira per day and 15 naira per month. Dial star 5058 hash. Make you enjoy.
Everywhere you go, MTN.
Do you know that you can obtain a specialist degree along with professional certification? Yes, that's the Wellspring University Edge. Wellspring University offers specialist degrees in cybersecurity, software engineering, information technology, computer science, accounting, taxation, mass communication, and business administration. For other courses, visit www.wellspringuniversity.edu.ng. Wellspring University offers postgraduate and undergraduate courses. Please call 0704 255 0535 or 0907 333 0526.
Let's take you to the world where the future is safe, where you can make your dreams happen day by day. Don't live your life to chance, invest in the easy way. All you got to do, 597. Let's take you to the world where the future is safe, where you can make your dreams happen day by day. Don't live your life to chance, invest in the easy way. All you got to do, 597.
Assalamu alaikum. Wa alaikum salam. Rama. You just dey come. Me, I don't break my fast though. With the food, where they give us for here. In fact, now so kill we kill before we collect ham.
So, all this stress on top say you want collect fruit for breaking fast. Don't worry yourself, because me don't get get fruit from Adron Homes. You remember I tell you about the Ramadan promo? You sef fit benefit from Adron Ramadan promo package. With chicken money like 25,000 naira initial deposit, you go get food pack or shopping voucher and even spread the payment within 24 months. You no finish for there. For every land where you buy, you sef go collect gift. If you can't pay 1 million income, you go collect food pack, bag of rice, goat, and even shopping voucher. Take join body. Waiting you they wait for. Oya sharply go Adron Homes, make you sef benefit from the Ramadan promo. For more tori, make you call us for 080-6753-0328 or 0708-897-6929.
Charles! Yes, mommy? Go and bring 2 sachets of hypo bleach for me. Why 2? Because I'm using one to soak the whites and using one to kill all the germs. But I can't see any germs here. They are so tiny you can't see them. But they are there. And that is why I trust only hypo bleach to kill them all.
Make your white fabrics whiter and your household free of illness causing germs and viruses with the disinfecting power of Hypo Bleach.
All right, welcome back to the Morning Crossfire. World Immunization Week, 24th to the 30th of this month. The last week of every April has been marked the World Immunization Week. And we're going to continue our discussion with Dr. Ijeoma Agbo, who is a Unicef Nigeria health specialist. And she's been talking with us about the great things happening with immunization in the country. We're not where we should be yet, but we've made great progress over the years. And we're hoping to consolidate on that and to speak up on the importance of vaccinations and immunization. Before I open the phone lines and I get to the messages on WhatsApp, 0809 597 5805, if you've got questions for Dr. Agbo. So what has been the activities been like? Because I know usually you have a packed out week for the immunization week. Give us an idea of what it's been like in the last week, Dr. Agbo.
Okay, so in the last week, there's been a lot of media engagements and advocacy, mostly around, of course, promoting vaccines. We're also trying to promote and urge government to increase investment in vaccination. But mostly it's been advocacy just to improve vaccine acceptance and continue to drive the message around the importance of vaccination of children and as well as adults for the adult vaccines.
Okay. Oh, brilliant. And then this cuts across the rural and urban areas also too, in terms of how the information is going out.
Most definitely. Of course, every information that goes out goes to everyone. Also, we're working with communities because the communities actually let us know what kind of services they need in their communities. And we also have a lot of community engagement, advocacy, stakeholder dialogues, just to understand what the issues are and how best we can meet those gaps.
Excellent. Vaccination brings us closer. The theme for this year's week.
Yes, vaccination brings us closer.
And the phone lines bring us closer to you too. 0700 993 993 993. Again, 0700 993 993 993. It'd be great to have the feedback from you on questions and comments you have around the World Immunization Week. I mean, such a huge advantage. A lot of people who aren't science inclined don't understand the remarkable progress that has had to be made as we do vaccinate and the sort of lessons we learn. People talk about. I was talking with a medical doctor some time back, and she was saying, if you know what has been leveraged on to achieve the COVID-19 vaccine, that they had to use some of the work and research done with the malaria vaccine, vaccine, and did put that into the COVID-19 vaccine. And look at where we are today. And I said, you see, if we didn't have vaccine research going up and already, we probably would not have had that opportunity to have even had the COVID-19 vaccine happen. But let's speak with Adegoke. Adegoke is in Lekki and joins us. Hello, good morning, Adegoke.
Morning, sir.
Excellent.
Morning to your guest.
Great. So you can speak with Dr. Agbo straight away.
Okay. Doctor, thanks for the good work you're doing.
Good morning.
Because I really want to know, like, for us who are genotype AA, we are mostly prone to malaria. For me, any single bite like this is like almost in 2 weeks, I just get that malaria, comes in, and one has to keep taking medication. So is there actually any side effect to basically constantly treating malaria with drugs? And for the vaccine, basically I joined maybe halfway somehow. So I don't know if in Nigeria we already have the vaccine rolled out.
Okay.
So those are my questions.
All right. Thank you very much, Adegoke. Adegoke is wondering whether we have the malaria vaccine rolled out here already, and any side effects from malaria drugs that he takes now and again, even though it's a type A.
Thanks so much for your question. Yes, as we have experienced over time, we see that those with genotype AA are usually prone, or they seem to come down with malaria. However, we always say that before you get treated with malaria, you should actually get tested. There are rapid kits available now to actually ensure that we confirm that we have malaria and not just go treating malaria, because sometimes there might be other reasons for our ill health. So it's when we get treated, when we get tested and it's confirmed that we have malaria, and then we get treated with the malaria drugs. And this is usually done at the health facility. So I hope that you're visiting the health facility and getting tested before getting treated for malaria. However, if you have malaria and you get treated with ACT drugs, then that is fine. There are no side effects aside from the usual side effects that you might have from taking drugs. But there are no side effects if you actually are being treated with the right drugs from the right pharmacies for malaria. Just as was mentioned earlier, it's still in the trial phase. The malaria vaccines is still in the trial phase. The second phase trial was done in Burkina Faso, and we've seen good results with the efficacy rates of about 75%. but they're moving on to another phase. So we're still not yet at the point where it will be rolled out. It's still going to go through the third trial phase, and is thereafter with the results that WHO, who provides that certification, would certify if it is ready for use by the public. So we have to wait, but pending that, we need to do all we can to prevent malaria. There are other measures by which we can prevent malaria using our insecticide-treated nets, ensuring that bushes and gutters around us are cleared. While we do that, we continue to prevent malaria and try to ensure that we keep malaria at bay. But hopefully within the next few months or years, I can't put a time frame to that. We hopefully will have a vaccine, but until then, let's do all we can to prevent it.
And we'll have Dr. Agbo here when we have that vaccine happen to talk about how we overcame malaria, which has been a nightmare for sub-Saharan Africa, and most importantly Nigeria, who does contribute. But by the way, if you're wondering why they went to Burkina Faso's got over 90% in terms of the infection rate. But we're about 35%, if I'm not mistaken. But we're way down the ladder in terms of So don't get frightened so much. It's just because of our population that those numbers do add up in that way for Nigeria, higher than other countries with malaria. Doctor, keep calling 0700 993 993 993. Any questions on vaccinations, immunization you want to find out, we can assist you. 01465 7190 is the number for the female callers. Again, 01465 7190, female only line. Dr. Agbo, people asking questions. You think that the vaccines is the magic bullet against infections? If you take the COVID-19 vaccine, for instance, would you have to do away with wearing masks? I had this heated debate with someone who was wondering, if you've taken the vaccine, why do you still have to wear the face mask? He kept asking me, and I kept trying to explain to him. But the more I explained to him, the more he kept attacking me. But I'll get your response to that when we speak with after we speak with Azubike, who is calling in from Orile. Hello, Azubike.
Okay, Mr. Tony. Good morning.
All right, Azubike, can you speak up a bit so we can hear you?
Okay. I want to ask the guest in the studio about this immunization of the sense that is going on in all Nigerians. And if you watch in Nigeria now, they talk a lot about immunization. That is the most important thing now, because most of our Nigerian citizens, they are dying in malaria, sicknesses. And why is it not Nigerian government to make it that they be treating malaria free in those general hospitals? And when we go there to go and check our health status, then some of them will find that we have malaria. And malaria is very, very dangerous than HIV. Why can't they make it so easy so that everybody can go to a general hospital and treat malaria free without making charging money? If they can be able to make it like that,
all right,
I believe that we can be able to eradicate malaria. And government should also help us to be cleaning our drainages. If it is not that opening drainage, let them have an covered drainages so a mosquito cannot be able to hide there and biting people.
All right, thank you very much. Thank you very much, Azubike. I'm not sure you could make the line was pretty bad, but apparently we're having a hybrid discussion in Azubike's mind. Azubike is talking about malaria, wondering why if it kills so many people, why can't people just get into the hospitals and get treated? But I think that's an entirely different conversation in terms of having access to health care and dealing with malaria. Somehow he even proposes the solution to the question he's asking. He says the open drainages be cleaned and be covered up. Of course, that's the major source for the mosquitoes which are infecting people.
Yeah.
Okay, I was going to get your response to the COVID-19 and the mask wearing after the vaccinations have happened, but there's an anonymous call coming in. Let's hear what you have to say. Hello and good morning.
Good morning.
All right, you want to be anonymous? Any reason for that?
No.
Okay, I was wondering because anyone says anonymous.
My question is that if someone has contracted the virus, COVID, and the person has been cured and using the vaccine, can the person still be infected again?
Okay,
Hello?
we got your question. Whether after taking the vaccines, the person still after the person has been cured of COVID-19, does the person still need to take the vaccine? Well, so I guess Dr. Agbo, you just respond to all the COVID questions.
Okay. So with the COVID-19 vaccines, it doesn't prevent us from getting the disease. However, it prevents us from getting the serious form of COVID. And the rationale behind that is to reduce, the amount of persons that are going into hospital. Of course, we know that with the COVID-19 pandemic, we had a huge burden on our isolation treatment centers. And a lot of our health workers were diverted to treating and managing serious cases of COVID. And so with the vaccines, it prevents us from getting the serious form of illness, whereby we don't have to get hospitalized, get on oxygen and all that. However, it does not, right now, it's not clear in terms of spreading the virus. So you might actually get the vaccine, or you might have had COVID previously, and still have COVID, but because it's not the serious form, you might not have symptoms. And so with that, you might actually still be spreading the virus to other persons within your family and the public. Now, with the vaccines that are being rolled out, it's being done in phases due to the supply. And with that, if you get vaccinated, you are protected, and you don't have the serious form of illness if you actually come down with COVID. But you are at risk of also spreading the disease to others who have not been vaccinated and are also vulnerable, whether they have comorbidities or they're elderly or children as well. And so that is why we are preaching that we continue to wear our masks to protect other persons and the spread of the virus. Absolutely. So that is why we still have to continue to wear our masks, practice physical distancing, despite the fact that we have been vaccinated.
Right. All right. I hope you've all heard. So those of you be bombarding Joyce and Sandra and all other presenters about having to wear the mask. You see what the reason is important, that that you don't go out and infect other people, even though you have been protected. I mean, it makes a lot of common sense. Let me see if I have any question on WhatsApp. 0809-597-5805. Okay, we don't have all the questions coming in from there yet. And you can call in 0700 993 993 993. So, Dr. Agbo, a lot of people also go in primary health care centers. And, let me take out the primary health care center question and deal with local vaccine. What about local vaccines, the capacity of the country, for example, to produce its own local vaccines? But before I get your response on the local vaccines question, let's speak with Ahigbe. Ahigbe is calling in from Festac. Hello, Ahigbe.
Yeah, good morning.
Good morning.
Good morning, doctor.
Good morning.
Hello, from the view of everything, I think everything goes on with hygiene and good diet. For instance, the social distances, washing of hands, and not touching, eating, drinking good water, making sure you eat the appropriate meal. I believe that most of the infection come from contamination of water and food. Even all those things people are using, they are not from heaven. There are many things joined together to boost the immune system. Is there no way one you can give an advice of what will actually boost the immune system against any form of diseases, apart from the contact of sexual intercourse, like what you call it, the contaminating diseases through sex?
Oh, all right.
To boost one's immune.
All right.
I think for the malaria, I believe when the system is not having enough vitamin, the malaria, the mosquito bite injecting infection seems to work in the body.
All right. Thank you very much, Ahigwe. Dr. Agbo, we have a number of medical doctors in quote.
We have, because she actually answered her question.
Oh my goodness. Boost the immune system. I want to also boost my immune system. I will be immune from every other disease you can find in the world. But I was talking about
Yes,
the
but
local
I like what
vaccine.
you said. Of
Yeah.
course, we need to continue to boost our immune system,
Right.
and of course, in terms of our diet, eat our balanced diet. We have a lot of nutritious food within the country.
Right.
Continue to maintain hygiene. So all this will boost our immunity. So thanks so much for that, ma'am.
Right. What about local vaccines? We're not where we used to be in the past. We understand the number of vaccines coming in into the country from outside the country, and we're already feeling the impact with what is going on in India because they are the vaccine manufacturing capital.
Yes. So thanks for what you just said. Africa represents 14% of the world's population. But in terms of the world's vaccine production, we're less than 0.1%. And so we need, as a continent, and I would say for Nigeria, we need to start to become self-sufficient in terms of production. I know that COVID-19 opened our eyes to this. We have a lot of research ongoing. I know the NIMA within Lagos has already started something in terms of researching and trying to get the lab more functional in terms of vaccine production. But also the country has released some money to support domestic vaccine production. But we still have a lot of work to do in terms of having a facility for that, as well as research that needs to go into that before we can actually get down to starting to produce vaccines needed for our country.
Absolutely. Thank you very much. Maybe we'll take in one more call, and then we'll get your closing thoughts on this World Vaccination Day. Dr. Ijeoma Agbo, United Nations Children's Fund, special health specialist. Let's speak with Peter Oshodi. Hello, Peter.
Hello, good morning.
Excellent. Your last caller this morning. Please go ahead.
Yeah. I want to appreciate Doctor for all our insightful comments. And my concern about this malaria is pretty high.
We need to turn this to malaria week.
Some years back, when a mother go for antenatal clinic, they are being handed free mosquito nets. What happened to that is no longer happening. And I really want to commend Doctor by giving us a statistical proof to the fact that some persons think Nigeria has the highest rates of malaria, not considering our population compared to other African countries, that you can add 5 or 6 countries together to make up Nigeria. Thank you and good morning.
All right. Thank you very much, Peter, for your comments. All right, Dr. Agbo, your reactions and then your closing thoughts.
Just as I say, we need to call this Malaria Week, but as it's Immunization Week, we'll also talk about other issues as well.
Right.
In terms of the nets, I know that the government as well as partners supported providing nets during antenatal to women. I know this is still continuing in some facilities, but I understand that maybe due to funding and other issues, this is not happening in some. But this is discussions that are ongoing just to ensure that we continue to drive promoting preventive measures for malaria, especially in our mothers, just to ensure that it doesn't pass on to our children that are in utero. So we apologize that this has happened, but we know that the country definitely is working at ensuring that we do all we can to prevent malaria, as well as other diseases. So I'm moving on to immunization that we're on. So I want us to leave with 3 messages from this World Immunization Week, which is that vaccines bring us closer. It brings us closer to what? It brings us closer to our family, our friends, and to everyone that we love. It brings us closer to a world where no one suffers or dies from vaccine-preventable diseases. And lastly, it brings us closer to a healthier and more prosperous world. And so we at Unicef, we continue to reiterate that vaccines are safe and effective and is actually the best and only way to keep all people protected against vaccine-preventable diseases. And we're reaffirming our commitment to continue to work and support the ministries of health to ensure that everyone in the country that needs vaccines gets it, especially our children and our vulnerable groups. And we're joining our voices, and we hope that everyone will use this historic opportunity to end the COVID-19 pandemic and set out a pathway to eradicating preventable diseases amongst our children and adolescents. This is a collective effort. We need everyone. We need you, the media, to continue to drive the right messages to improve uptake of immunization and other services.
Right.
And we hope that everyone will continue to take preventive measures and have confidence in our life-saving power of vaccines.
All right.
Thank you.
Thank you very much, Dr. Ijeoma Agbo, UNICEF Nigeria Health Specialist, on this World Immunization Week. All right. All right, so we go on a quick break, and when we come back, it will be time for us to win 10,000 naira.
A multinational company in Lekki, Lagos is massively recruiting independent sales executives that own a car.
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's